Now I'm about to introduce a very talented young lady and doctor. Her name is Dr. Michele Schaeffer. Now I've known Dr. Michele for a number of years. I was involved with one of her studies. And she is a research associate at the UBC Center for Heart-Lung Innovation, working with Drs. Jordan Gannett and Dr. Chris Ryerson. Her work aims to help relieve activity-related breathlessness and develop more effective ILD-specific exercising training strategies. And on a personal level, Michele was at one time a competitive cyclist, but doesn't compete anymore, but she's a huge cyclist, so just thought I'd throw that in. Welcome, Dr. Michele.
All right, well, thank you for having me. So today we're going to talk about physical activity and exercise. And just a full disclosure, I'm the other kind of doctor. I have a PhD, I'm not an MD. So everything I say is some good information and some suggestions, but it's always really important to have your care team involved in some of the decisions that you're making. And if you have questions, really consult with them. And I'm hoping to keep it short so we have time for a nice discussion, and hopefully this can be a bit interactive. So I was tasked with talking about exercise. Why do we need to move? And the big why is for a few things. So when you have something like interstitial lung disease, it causes a reduction in your lung function. And that can cause a lot of breathlessness, especially with physical activity. And when you're breathless, it's pretty unpleasant, and it makes you want to avoid the things that make you breathless, right? So let's say walking up the stairs makes you breathless. You're probably going to do that less often than you did before because it doesn't feel very good. But the issue is that when you start avoiding these activities, you become a little bit deconditioned. And so if you don't walk up the stairs, walking up the stairs becomes harder. And that goes for even simpler tasks as well. And so by avoiding these activities, we become less fit. And when we become less fit, we're going to avoid even lesser activities now, right? So if the stairs were hard, now maybe the dishes are hard. It becomes this really challenging downward cycle, and it's really hard to get out of that. And when we become less fit, even small daily tasks can feel unpleasant and overwhelming, and that can lead to isolation, a poor mood, and really bad outcomes here. So I really think that exercise can help us break that downward cycle. And so we know that exercise is good for our bodies. It can be really helpful for symptom management, especially for lung disease. So if you're more fit, you actually breathe a little bit less for that activity. It's like if you think about somebody running who's fit versus not so fit. The one that's not so fit is huffing and puffing, right? But the one that has that fitness can breathe a little bit less for that activity. So I think it can be really helpful for something like symptom management within a reasonable level. And physical activity also helps our bodies stay resilient to other things. It keeps us strong and it keeps us capable. And it allows us to maintain our physical independence. And it's also really good for our minds as well, right? So exercise allows us to be socially connected, and it also allows us to stay involved and engaged within our communities. So there's some really important aspects of physical activity. Now, when we're talking about exercise, there are some structured guided options, and that's mainly in the form of pulmonary rehabilitation. How many people here have participated in pulmonary rehabilitation so far? Anyone? Quite a bit, okay, and some not so much. So I'm just gonna go through the components that you can expect with something like pulmonary rehab, and then we'll go into some discussion on exercising on your own as well. So pulmonary rehab is a supervised comprehensive program with a few components, and the goals of pulmonary rehab are to have less breathing discomfort, so reduce our unpleasant breathlessness, to improve our physical fitness and our ability to do activities, and to have a better quality of life. As we just saw, it's good for our bodies and it's good for our minds. And the hope is that this leads to some long-term activity or lifestyle changes, right, to maintain that physical activity, and that's where it gets really challenging, and we'll get into that. So there are some non-exercise components of pulmonary rehab. There's an education component where you can learn more about the situation that you're in and strategies for managing your symptoms on your own. There's also nutrition or dietary support, and there's also psychological support, which I think is really important. And then there's exercise training, and there's a reason why this gear is a little bit bigger than the non-exercise, and I really think it's the cornerstone element, the keystone element of pulmonary rehab. And so that usually is a combination of things like aerobic or endurance training, such as cycling on a stationary bike or treadmill walking, resistance training, so upper and lower body, strength training, small weights, body weight, other things like that, as well as flexibility and things like balance, which are really important to translate outside of the gym or the exercise rehab setting. And so while you're doing your exercise training, there's two main components, like I mentioned, endurance training and resistance training. Typically, these programs are 5 to 12 weeks. I think it depends on the center, and they generally have at least 2 supervised sessions per week. It is a bonus if you can do some sessions at home for exercise to help reach 3 to 5 total sessions a week. We know that a minimum of 3 is kind of what you need to get the most benefit from exercise. 2 is okay, but 3 is even better. For endurance training, it typically involves a bike or a treadmill, and the target is about 30 minutes, progressing the intensity gradually. And I think it's really important to think about progression in terms of exercise. So you need to consistently do a little bit more over time in order to get better. So if I did 1 push-up every day, let's say my goal is to do 5 push-ups. If I kept just doing 1 push-up every day, it's gonna be really hard to get to that 5, right? So over time, maybe I'll feel finally comfortable with 1, and then I can try 2. Maybe the second one's on my knees or with assistance, and then slowly you can build to that 5. So I think we need to think about that principle with our exercise, is always trying to do a little bit more to reach our goals, and the progression is really important. It's okay to break up the 30 minutes. So I know 30 minutes on a treadmill or a bike can be extremely boring and sometimes pretty taxing. There's some good evidence for something like interval training, if you've ever heard of that. So you kind of split up a minute hard with 2 minute easy, or just a few things like that, just to break up the efforts. And some people find it's actually more tolerable for their symptoms to do a little push and then recover. So that 30 minutes doesn't have to be just a steady 30 minutes, and I think that's important. For the resistance training, people can use bands or free weights or even body weight squats. Those are really challenging as well. Typically, you do 10 to 15 repetitions of 2 to 3 sets. So I'll do 10 bicep curls 3 times, for example, would be a set. And those are progressed by increasing the weight, the number of reps or sets, or reducing the rest between them. So there's a few different ways that you can progress, like I mentioned before, with the resistance training. And often it's really good that these programs will focus on exercises that reflect daily activities, such as we discussed, being able to go up the stairs, being able to stand up off of a bench, things like that. So I think functional fitness and exercises that reflect the activities that we're doing in our everyday life are really helpful. So there have been a few good research studies looking at the benefit of pulmonary rehab, especially the exercise component, for people with interstitial lung disease. And some of the questions that I often get are, does the type and severity of my ILD matter? And the answer is no. I think it can really help across the spectrum of different kinds of interstitial lung disease. And people with milder disease or starting sooner may see greater and more durable gains, so ones that last longer over time. But I don't think that's a reason not to do it, even if you're given the opportunity later. It's never too late to start. So is there optimal timing for me to get the most benefit? And sure, as I just mentioned, sooner is better to build and preserve gains. But even people with really advanced ILD who haven't done any exercise yet can still benefit from exercise rehabilitation. So it's never too late to start. And benefits are even possible post-transplant, right? So I think there's room for exercise for everyone at different stages, and I think it is appropriate. How can I make the most of my exercise training? Attendance matters. So consistency really, really matters. We know that less than 2 exercise sessions a week rarely induce kind of a meaningful benefit. So if you're gonna put in the time, make it count, right? So I think the minimum of 3 really is what you wanna strive for. And I appreciate, it's not always possible. Life happens, right? Things happen. But if you can try to be consistent with your 3 a week, I think it would go a long way and make that effort worthwhile. And as I mentioned before, progression is required. So if you continue to do just the same thing every time, it's hard to really get a larger benefit and make yourself stronger. If you do the same thing, you'll maintain. But I think the goal here is really to bring up that capacity and get as fit as we can, right? So you can do that by pushing yourself, but within your plan and within reason. So you're gonna have a plan in your pulmonary rehab program. You have supervision with trained exercise specialists, and they'll help you learn how to progress safely and properly, and also within reason. So letting symptoms be your guide. As I mentioned, there's no one size fits all, and certain things feel better for different people. So I think we need to be mindful of that. So pushing ourselves within our limitations safely and within our abilities. So I found this pretty striking that there's a statistic that adults spend 60 to 70% of their waking time sitting. And I'm extremely guilty of this myself. Even when I was a professional cyclist, I had to fill out a questionnaire in our lab. I participated in a research study and it asked how often I sit. So I would do my 1 to 2 hours of training every day, and then I would just sit all day. And it's really, really unhealthy, okay? So it's tied with poor health outcomes. And I think the new Canadian 24-hour movement guidelines was really trying to break those habits of just sitting all day. And they've really shown to be linked with more positive health outcomes. So rather than the WHO and all of these other organizations have this target for 150 minutes of moderate to vigorous physical activity week, which accumulates to about 30 minutes a day through Monday through Friday. That's a lot, but I think that the new Canadian 24-hour move guidelines makes it a little bit more tangible and feasible. And I think it's appropriate for all of us in this room really to continue to strive towards those movement goals, regardless of your situation. So you can look these up as well, but basically you have 3 pillars of physical activity, sleep, and sedentary behavior. And it does mention that 150 minutes per week of physical activity, and I'll talk about on the next slide how we can approach that target in a little more digestible way. It also mentions the importance of sleep. So if you're doing a lot of physical activity, you need to make sure that you recover, and sleep just prepares us and our bodies for the day ahead, regardless of what the task is. And then the big important thing is the reduction in sedentary behavior. So not trying to spend too much time on our screens, not sitting all day. So even breaking it up to go for, standing up to do something quickly in the home, to break up a couple TV shows, I think it's really helpful. So trying to sit for less consistent time in each bout, making sure we get enough sleep and moving more. So I think we can all still strive towards this 24-hour movement guideline. So exercising on your own, it didn't really work here, but so I think the important thing is choose activities you enjoy. So it doesn't have to be, exercise doesn't have to be going to the gym. It doesn't have to be riding a stationary bike. It can be walking the dog. It can be a hobby in your home that requires standing. It can be many other things. And I think we're more likely to do those things if we like doing them, right? Set small goals and make plans to hold yourself accountable. So even myself, I love exercise. I research exercise. I do a lot of exercise. Sometimes I need to be motivated to exercise. And for me, making a plan, I have a bit of a schedule every week just to hold myself accountable. And I also have training partners. So that can be your household partner. It can be a friend that becomes a training partner, somebody that you enjoy doing the same activities with. And I think just making that plan holds you accountable to do the activity. And something I always tell myself is I never regret going. So sometimes it really it's an effort to get to the activity or to get yourself prepared for it. But how often do we actually regret doing it? Probably not very often, right? It feels good. You have some connection. And I think it's important to reflect on that too. Self-monitoring is also really good and very important. So one way that you can sort of track your activities, you can have a journal, but there's lots of wearable devices now, watches, Fitbits, all these gadgets that can help us track our movement, and those can be helpful. And as well as apps on phones, so the phones can, if you carry them all the time, I know my iPhone tells me my steps per day and things like that. So there's ways where you can sort of track where you're at and monitor your progress and maybe set some goals for yourself with those devices. And also pulse oximeters. So I think specifically in people with interstitial lung disease, you may be more prone to having lower oxygen saturation. And we know that going too low is not a very good idea. So typically, while we're exercising, above 88% is where you want to stay. So you want to make sure the intensity of your activity isn't bringing your saturation lower than that. Dr. Ryerson, who some of you may know, has a bit of a rule of thumb. You can go down a little bit for up to 1 to 2 minutes if you're doing a finishing push for activity, but don't hang out there. It's not a good place to be, okay? So you can go between, I think he said 82 to 88% for that very small amount of time, but we never want to go below 82. That's where things get a little bit problematic. So I really encourage you guys, if you don't have already, to just have a little pulse oximeter and monitor your intensity that way. It can be very helpful. You can break longer bouts of exercise into short intervals, as I mentioned. So let's say you have 30, you're trying to do 30 minutes of your walking. You can do maybe a minute a little bit faster and then 2 minutes relaxed, or however you want to break it up, just to keep it engaging, exciting. And sometimes those intensity sort of intermix with our recovery periods helps with those breathlessness symptoms. And importantly, let symptoms be your guide. So stop and rest if you feel unwell. And if you have any new or changing symptoms that are concerning, definitely discuss those with your care team. So keep your care team involved and make sure they know if anything feels particularly not right or if you're unwell. There's a new concept coming out of the UK that I really like called snacktivity. Has anybody heard of this? Exercise snacks? So I personally think the idea of 150 minutes sounds like a lot. 30 minutes a day of dedicated activity sounds like a lot. But there's now an idea that you can have these small but frequent exercise snacks of moderate to physical activity throughout the day. And one snack is about 2 to 5 minutes long. So things like walking and talking while you're on the phone, choosing to take the stairs instead of the lift, that can be a snack, activity snack. Pacing during a phone call, parking a couple spots further away when you're going to the shop. These things are physical activity. These things are exercise, and they do count towards your 150 minutes. So it doesn't have to all be in one bout, right? It can be in these smaller little bouts. There's also ways to do strength training with these activity snacks. These are ones that are suggested or were mentioned by the snacktivity group, but squats while brushing your teeth or calf raises while you're waiting for your tea to boil. There's like little things you can do throughout the day, and I encourage you to think about those if you're not a structured, set person with your 30-minute bouts of exercise, right? So just think about your total minutes. Can you get up to that total minutes of 30 a day of doing these small movements? So I actually really like that idea. So some future directions. I know that it's really frustrating that there's not a clear guide for you to follow, like this is what I have to do for my exercise. And unfortunately, we don't know a lot about specific ways to optimize exercise training for people with interstitial lung disease. But I promise that we're working on it. Here in Vancouver especially, we're one of the few research centers in the world that have a dedicated team that is looking at exercise for individuals with interstitial lung disease. Some of you have visited our laboratory at St. Paul's. This is our research group here, led by Dr. Jordan Gannett. We've done some exercise studies looking at ways to deliver oxygen during exercise that may be more effective in people with interstitial lung disease. We're also doing one right now with beetroot juice. We're looking at dietary interventions. We're really trying to address this from multiple standpoints right now, and there's a lot of questions we still have to answer. So with that, I'd like to thank the team at St. Paul's, Dr. Gannett and Dr. Ryerson, as well as our collaborators and the patients and their families that have volunteered to help us figure out and do more with this work for people with interstitial lung disease. So with that, I open the floor to any questions that you guys may have about exercise. Yep.
Does doing things like painting in my workshop, like boards and working around the yard and things, does that count to exercise at all?
Yeah, so I mean, standing is some form of exertion. I could definitely consider standing and painting is probably a lighter activity versus moderate, right. But yard work for sure is generally very moderate. So those are definitely moments of activity. So I think those definitely count. And yeah, that's a good one, especially the yard work for sure.
Hi. From a perspective of cardiopulmonary, building a cardiopulmonary reserve, what intensity should be aimed for? Weight training, things like this, or no, just this low intensity activity? Or bigger question is, does building those reserves are going to help an ILD patient? So yeah. Say an ILD patient builds a amazing cardiopulmonary reserve and things like that. Is this really going to matter or going to help?
Yeah, 100% it's going to matter. So I'll answer the first part in terms of the intensity. So that, unfortunately, right now, like I said, there aren't population-specific guidelines specifically for ILD. So we're really working off the general population guidelines, and the current recommendations are based off the American College of Sports Medicine guidelines for healthy older adults in terms of strength and endurance training. With that said, I think the intensity of the suggested intensity to get meaningful health benefits is that 150 minutes at moderate to vigorous. Some people need to slowly ramp up and start with lighter activities, but those are still meaningful in helping us work towards our moderate to vigorous. So the goal would be 150 minutes cumulative over the week of something that's moderate to vigorous, so where you do feel like you're exerting yourself, right? In terms of the resistance component of that, I think it starts at an individual's level at where they're at. And so based on the ACSM guidelines for healthy older adults, it is, like I said, 10 to 15 reps of 2 to 3 sets. So there's not a specific training manual. I think everybody has their own differences in their abilities, so you can target your weaknesses. But core strength, for example, and stability exercises and functional training, I think is where I'd probably start before I built into, like a regimen to get my biceps really big. So I think functional training. The other component of that, I'll get to you next, just one more quick thing. You said, will it really help building that big reserve? 100%. So if you are more fit, activities of daily living are less compared to your total. So let's say my fitness is up here and my house chores are here. I'm gonna be less breathless during those house chores than if my maximum fitness is here. Because you can sense how close you are to your maximum, right? And that's when it becomes uncomfortable. And sure, some of those things will always be uncomfortable. I will always find running challenging. It is very hard for me. So I think the perspective is that if you continue to build this capacity or even just maintain that high capacity, then those activities in your normal life will feel less strenuous. So I think there is a benefit for that. Yeah. Did that answer your questions? Okay.
Along those lines, so I'm a respiratory therapist that works in pulmonary rehab. We get the intensity question a lot. And in addition to the tools that were provided, we sometimes also use a shortness of breath score. So in pulmonary rehab, when you're exercising at that moderate intensity, we use a shortness of breath score so you know based on the shortness of breath you're feeling kind of where you are in that intensity. So then when you go off and you do your snack activities, which I love, or you're exercising on your own, you kind of have a sense with your shortness of breath scale and can kind of adjust your activities to the right intensity. So just an additional tool that we sometimes use.
Just to follow up, I have a question for you on that I think might be helpful. So for the individuals who haven't participated in pulmonary rehab yet, I think pulmonary rehab is a great place to start because it gives you the tools and equipment to continue on your own, like that knowledge base. But where on the 0 to 10 scale, where is that moderate intensity that you guys prescribe, and what does that correspond to in words? Is it strong? Is it, there's the words on the Borg scale as well.
Yeah, so we do a little bit of individual coaching on it. We use around that 3 to 5 on the Borg scale, and so we do a bit of a talk test with that sometimes to see what that means. So if you can say your phone number, for example, and you can get at least sort of 3 to 4 numbers in before you have to take your breath, that's sort of a good intensity. Whereas if you have to say a number, take your breath, say a number, that's a bit too high. And so it's kind of working through pulmonary rehab, which takes time. So our program's 8 weeks. And so it's kind of working through that, engaging, because everyone's so individual, what your intensity level is on that shortness of breath scale.
And for those that find their intensity of breathlessness really high, that's where I think some of those intervals can be helpful. So you can, challenge yourself for a minute and then take it easy for 1 to 3 minutes and try again. So that's a way to sort of circumvent that severe breathlessness, but still get in your minutes of activity. So that was good. I think I saw a question over here. Oh, are we done?
Can I just say,
Sure.
for anybody on the panel,
Okay.
obviously we're interested in this and I love it, but we and Darcy will.
I'll be back.
Let's give Dr. Michele a big hand everybody, for that amazing information.